Good morning, everybody. I would like to welcome you all to the panel session on continuity of operations amidst COVID-19. I have a power-packed panel for this morning's session. So I think what we'll do is that we'll start off with short intros and then we'll get right into the discussion. So I'll start off with myself. My name is Farooq Nair. I'll be the moderator for today's session. I am the Chief Information Security Officer for Orion, which is the Research and Education Network for the province of Ontario. Over to you, Julie.
Hi there, good morning. I'm Julie Adams, the Chief Executive Officer and co-founder of ShiftLink. And ShiftLink is a Canadian software company, and we're dedicated to helping organizations increase efficiencies and reduce costs associated with filling shifts in any industry.
Thank you, Julie. Amber.
Hi, my name is Amber Vandenberg, and I'm the founder of the Ninja Group. And so we do training for various organizations to improve team performance. So we focus on teams and the different dynamics within those organizations to better overall performance.
Thank you, Amber. Kashif.
Yes, good morning, everyone. My name is Kashif Parvez, and I am the Chief Information Security Officer at the University Health Network, the largest teaching and research hospital in Canada.
Thank you. Scott.
Good morning, all. My name is Scott Curry. I'm the Chief Information Security Officer at the Hospital for Sick Children in Toronto, and it's one of the world's leading pediatric clinical care and research organizations.
Okay, Scott. So let's get this started, guys. I'm really excited. So I think I'll start off with my first question, and my first question is for Scott Curry. So, Scott, the question for you is that the last time the hospitals in GTA, which is the Greater Toronto Area, encountered a situation close to COVID-19, I would call it a pandemic, but it was an epidemic, which was back in 2003 when we had the SARS epidemic. Was that experience helpful for our healthcare institutions or hospitals in being prepared for COVID-19?
So I'd say that there were definitely some key lessons learned coming out of SARS that were definitely helpful to us as we began the journey towards responding to what COVID-19 brought to us. I think broadly speaking, from a clinical perspective, it highlighted some of the key changes that needed to be made within healthcare organizations in order to be able to support the health and well-being both of staff and patients, and actually led to some changes to the way stocks were managed in order to ensure that we had spares for situations such as this of PPE and ventilators and other devices like that. That has definitely allowed us as an organization to be much more responsive in terms of protecting the organization as well as the patients and families that come. I'd say, however, there were definitely some key differences that we've really had to sort of think through as we respond to the current situation. And I think that really is tied a little bit to the state of technology between 2003 and today. One of the major impacts that we've seen across our organization is that we've had a really rapid transition, not only to remote work, but also to be able to support virtual care across our population. And the ability to rapidly deploy technology to allow easy virtual care for patients and families and our physicians and between institutions is something that we simply couldn't do in 2003. And so we've really had to think through on the fly, how do we enable that technology? How do we enable it in a secure way? How do we ensure that our patients and families have confidence in the fact that the data that is being broadcast across those different channels is being managed appropriately? And so I think there's definitely some key differences, and certainly one of the most significant differences is obviously the impact that this has had more broadly in the community, and ensuring that we have the capability across the community to support people that are maybe otherwise unable to come into the hospital in person. And so I do think that there were definitely some key lessons learned, and I think coming out of this pandemic, we're going to have even more to look back on to allow us to learn and develop new ways of interacting with the healthcare communities.
Okay, great. Thanks. Okay, so moving on to Kashif from UHN, and I think that's more of a add-on question to what Scott just spoke about. So the workforce in hospitals has responded to the pandemic in a very unique way. I mean, while the rest of the world is working remotely, for the hospitals, it's business as usual, for lack of a better word, or in fact, it's more than business as usual. And of course, most of the workforce that you guys support are on site. So my question to you is, Cash, that does the same apply for your IT team or your IT support team? And of course, how are you coping up with the need of the stakeholders based on that right now?
So yeah, thanks for the question, Farooq. Yeah, I mean, like in IT, I guess we have the luxury, I guess you could say, of working remotely for the most part, and then that does facilitate things a lot. And for the frontline healthcare workers, what we've done actually, and I think Scott alluded to it a little bit earlier as well in the first question, is that we have actually taken a chance to review all the services that are being provided, and where can technology sort of enable that, and to allow them the flexibility to work remotely as well. So it's not like, I mean, things that used to be given you know, at the bedside and required someone to be there, we actually had a chance now to review that, and actually the clinicians are asking for it, is, you know, some of these things with virtual care, leveraging what we call WOW carts, workstations on wheels in the healthcare sector, to use them in different ways so you can actually not require someone to be there. That's being looked at as well. So I think Scott had used the right word. It's enabler, really, is what it is. And to give them the flexibility so they don't have to put themselves in situations. Yes, there will be situations where they have to be physically present, but only in situations where they actually have to be, where it can be delivered virtually. That's what we're trying to do, and allow our technology to do that. We've been able to transform the and accelerate, I guess, you know, this Microsoft Teams is our technology that we use for internally. And we were in the process of rolling that out, and with this whole COVID thing, we had to roll it out in a much more, I guess, expedited fashion. And we were able to do that in a couple of weeks, and that's allowed everyone to be able to collaborate a lot easier, both internally as well as in collaboration with external healthcare providers as well. So that's
Okay, that's good. Just doing a sound check. Can everybody hear me okay now?
Yep.
Okay, yeah, okay. Okay, good. And I think I just want to give a shout out to, all the teams who have been supporting the frontline workers, because apart from the frontline workers, there are lots of people behind the scene, like IT operations, and of course the engineering, heating and ventilation, and of course lots of teams which are ensuring that the hospitals are able to keep the lights on. So hats off to everybody who's playing their role, and of course the IT, as Cash and Scott explained, are the key enabler in this whole equation. So yeah, just wanted to mention that. So moving ahead, I'd like to now bring in Julie into the discussion. And of course, Julie has been running a startup in healthcare schedule management space. And of course, right now, the need for schedule management is even more critical for healthcare workers and hospitals. So, Julie, how has your organization stepped up to the needs of the customers and your consumers in the wake of COVID-19?
Sure, yeah, thanks, Farooq. So ShiftLink is automated shift filling software. So it allows managers to instantly notify their high-skilled staff, mostly in unionized environments, of shift opportunities. So during the pandemic, we've seen an increase of shifts that are posted and new clients coming on board to support their COVID-19 patients or clients, and depending on whether they're hospitals or shelters. Our existing customers are using the platform more frequently with specific changes to support their COVID-19 efforts. So if a hospital downtown Toronto is adding a new department specifically for COVID-19 patients, they're calling us so that we can accommodate that shift filling for them. And we've really noticed our numbers speak for themselves, really. Compared to the same time last year, we've seen a 13% increase in the system usage. So we're happy to report that it's working, and it's working for this critical time. So I guess another point is just sort of, despite COVID-19 and businesses taking drastic measures to change the way that they operate to sustain their operations, with having ShiftLink in place, hospitals and shelters are able to respond really quickly and efficiently to their increasing demands that they've seen more recently. In terms of implementation of our platform, we've been able to personally reduce our go live time from 30 days down to 48 hours. And I really believe that this level of responsiveness on our team is critical, especially right now. And we're really, proud and that we're able to provide this customized solution so quickly for our existing clients and any future clients.
Amazing. And in terms of the growth in your client base, how much growth have you experienced in the past 8 to 10 weeks?
Oh my goodness. In terms of clients, we've onboarded a few new ones, and also just the volume of shifts that are getting posted, we're into the millions. In the last 2 months alone, we've posted about 2 million shifts.
Oh, amazing, amazing. I think they always say that never waste a good crisis.
Absolutely.
And I think, yeah, that's something that completely maps onto your scenario. But I mean, I think ShiftLink can be seen as a key player in schedule management for healthcare in GTA and beyond. So, I mean, thanks a lot for the contribution you're making to the community, Julie. It's really
Thank you.
Yeah. Okay, so I would like to bring in Amber to the conversation now. And Amber is a specialist in the field of human resource management. And I always tell people that people is the most important, people management of people are the most important piece in the equation. And I think given the current situation, I think human resource has been the most critical element. I mean, without humans or without frontline workers or without the supporting organizations, we won't be able to respond to the current pandemic in the way we are doing that right now. So my question to you is that what are the key components from the HR strategy and policy point of view that these organizations need to consider in the current pandemic situation? And when I say organizations, I'm talking about the frontline organizations.
Absolutely. Yes. Well, definitely making it through this crisis, but then also preparing for the future. Communication is going to be number one. So no matter the policy or the strategy you have, if it's not well communicated and clearly communicated to your employees, it's not going to do as much good. So it's critical that the strategies that we have in place, especially during this time, whenever everything is changing so quickly, that we have a system that we can quickly reach our employees in a timely manner with clear communication. So that really has been a huge focus on our end and with the teams that I've been working with on ways that we can effectively communicate with our teams. Now, moving from that a little bit more towards a policy standpoint, there has been a little bit more of a shift with our frontline workers and with the entire healthcare system on a clear sense of wellness and safety within the organization, within your workspace. And wellness and safety comes down to, yes, physical wellness and safety, but also people are looking more towards mental health and making sure that we are keeping our employees well trained and sharp so we can avoid some burnout and fatigue. And so being cognizant of the ways that we can best serve our employees so that they can be fresh, they can be sharp, and be best prepared to serve our patients. So there is the saying, patients come second. We need to make sure that our employees are fresh and equipped to be able to serve. And so these ideas are very important so that we can have our teams that are more agile, more innovative, and best equipped to serve our patients.
Okay, good. Just a quick follow-up question to that. From the HR point of view, do you think that the shift in culture, of working on premises and now working from home for an indefinite period, how do you think that has affected HR practices in organizations or the culture?
dramatically in every way. So human resources really comes down to four main pillars, and that's to build your team, to bring value to your team, to train and retain your team. And moving from a more remote workplace has affected all four pillars. In the building your team, it has affected the way that we are seeking out our new employees. So there's a more heightened emphasis on adaptability, on trainability, on ability to use technology and adapt to evolving technology. On bringing value to your team, again, there's a huge aspect of wellness, but also a huge emphasis on more of the human element, right? The soft skills that come with our team. So there has been this work-life balance and more of a scale, but in reality, especially in this time, the two are coming closer and closer together, hand in hand. And so it's really more of an arm wrestling match, right? So the two are very much in tension. And so we have to find a way so that we can provide a more sense of synergy within that. And so there has been a massive emphasis on the training aspect of empathy and communication and collaboration within our teams so that we can work better from in a remote aspect and physically as well. And so training within that and actively practicing those muscles, especially in a remote workforce, is something that isn't going to happen as naturally. There has to be a level of intentionality. And so when it comes to human resources, it really is within our realm to provide those opportunities and to set the precedent and set the expectation that it's not just working from home, it's being at home and still working, right? And so you are bringing that work life together closer and closer. And so we have to be able to serve our employees the best way that we can to provide that wellness and that health and that environment for great performance while they're still in the household.
Sure. No, yeah. Thank you, Amber. Those were some really good pointers from the human resource management point of view. So, okay, so coming back to Scott Curry now. So it's been a bit more than 2 months since the province has been in a state of emergency. And of course, there are other provinces also declared a state of emergency amid COVID-19. What has been the business impact to your hospital, and how has technology operations been keeping up with the needs of the business?
Well, I mean, I think it's pretty clear that across every sector that business operations has been impacted, and I think we're absolutely no exception. There's been significant changes in all manner of the operations of the hospital, whether it's our clinical operations, whether it's our cleaning, whether it's our transport teams, IT teams, etc. All have faced a number of challenges associated with responding to the current pandemic situation. Across the board, I'd say that the technology operations has been absolutely critical in ensuring that all of those other functions are able to operate in as seamless a way as possible, despite numerous types of transitions, whether those transitions be the work from home that's been increasing steadily, to the virtual care, to a series of other technology requirements that have evolved as a result of COVID. We are looking in many different areas for new types of technology that can help us to support what clinical care looks like in the midst of a pandemic. How can we get new types of devices that are smaller, more portable, and easier to clean? How can we ensure that data is flowing more easily when we have multiple disparate systems that may not all necessarily be co-located on our campus? And so we've had to react in many, many different ways in order to keep up with the demands that COVID is placing on the organization. And those demands are evolving themselves quite constantly. I think if you look at the way we operate today versus the way we operated at the beginning of the pandemic, it's quite different in terms of how we manage people coming into and leaving the hospital. How do we ensure that our staff and patients are healthy? And throughout all of those is woven the undercurrent of the technology support that's required. Today's clinical care is by and large done electronically. The days of paper are behind us. We've implemented a complete end-to-end electronic clinical workflow system and health information system with electronic medical records that's absolutely critical to the maintenance of our clinical operations, whether those be on-site or in person, or where we've shifted those to a more virtual. Certainly, we've changed the type of services that we deploy on site. We've had to make some decisions as to what we will and will not continue to do in the midst of a pandemic. And as we've done that, we've had to think about how do we then reallocate staff from some of those impacted clinical areas into other, more relevant COVID-related response type activities, whether that be screening or distribution of PPE. And all of this, again, is woven through how do we support that from a technology perspective, because it certainly relies in all cases on us ensuring that our electronic systems are up and available. And from my perspective, obviously security being a huge part about that, which is how do we ensure that we're doing everything we can in the midst of the threats that are evolving through COVID to ensure that we're maintaining the type of integrity around those systems and the availability around those systems to ensure that they're available for our clinical and frontline staff when they're needed.
Okay, good. Yeah. Thanks, Scott. Okay, so moving on to Kashif now. So, Scott, Cash, and of course both, and of course me. We all three of us are CISOs, and of course our full-time job is working on overseeing cybersecurity or overseeing the cybersecurity. So, from the cybersecurity point of view, there has been a significant surge in cybersecurity attacks, especially on healthcare institutions. And of course, as per the Canadian Centre of Cybersecurity, they have elevated the threat level of all healthcare institutions or any healthcare research organizations who are supporting the frontline workers or perhaps who are working on the cure for COVID-19. So how has UHN been coping up with the recent cyber threats or recent surge in phishing attacks and cybersecurity attacks?
Yeah, it's a great question, Farouk. And yes, it's definitely there. We've seen that across the industry in healthcare, and as you know, I guess this pandemic, there's hackers don't take a backseat. They seize the opportunity, and they know that people are heightened awareness of COVID-19. So these COVID-19 emails are coming in fast and frequent. Like here's the latest numbers, or here's the cure to COVID-19, all these links that are out there. So yes, it's definitely an issue. And so we have heightened, in response, we've heightened a lot of our security awareness communications that go out, all employees communications that are happening very frequently. The other issue that we've been seeing is a lot of employees who in their normal job would not have been working from home, whether they be administrative assistants or some other, other workers who are typically just office type employees, have now been asked to work remotely. And then the problem is that deploying laptops so quickly to people and switching them out from their normal workstations is can't be done that quickly. So we have seen, and we've had to make some concessions to allow people to actually leverage remote their own personal computers to connect into the network, right? And with that comes a whole bunch of other challenges, as you know, security-wise. So what we're trying to do there is as many applications that we can push out to web-based remote access. We're doing that. However, there are instances where the need to connect in over VPN on computers that are not issued by our own organization. So this is a huge risk. In response, we've had to heighten our monitoring and response capabilities. And it has happened. There have been infected remote computers that come in via that. But these are the kind of risks that need to be taken to allow people to work. So to support them, we give them sort of updates on how to secure their home computers as well, their home networks from this side of the thing. We recognize that personal computers are they're not just tied to one person. Some people can have their kids on them at any time. Some people can have their their spouse on them. So we need to help them secure that environment as well. So we've had to actually extend some of our services out to do that for the sake of securing our own internal network. So these are kind of changes that have had to happen quickly in response to this pandemic.
Okay, thanks, Cash. So I'm just doing a time check right now. The time is 12 past 11 a.m. right now, and I think we have time until 11:30. So I think I might be able to squeeze in another question before we go on to the concluding remarks and Q&A. So, and I think I'll probably ask Julie that question. So, Julie, you are running a startup, and of course, you're supporting so many organizations. So, how has the experience been in managing teams while working from home or managing teams remotely?
Sure. So, well, we've always been able to work virtually as an organization. So we believe strongly in bringing on top talent, regardless of where they live. So we're seeing this new normal of working from home as a confirmation of our decision to stay nimble and adapt to any curveballs that get thrown our way. Our team can onboard, any volume of new clients who are in need of optimizing their shift filling process. We can offer the solution within hours, depending on the size of the organization. Our technology team has really taken this opportunity to optimize the client service experience again. And like I said, we can create a customized solution for any company. We provide virtual training. We can meet with, virtually with frontline staff. We can support managers. We're available 24/7. We work with the unions, email, video, toll-free number, all of that's in place. So, we can confidently say that our infrastructure is available, it's reliable. We're hosted in Microsoft Azure, so we know it's safe and secure. And really, we're ready to take on any challenges that arise, and we've been able to prove to ourselves and to our clients that we can face them head on, and that we're able to adapt and adapt on the fly to meet their needs.
Amazing. So I think I'd like to now bring in Amber into the conversation. So Amber, your general opinion about managing teams remotely, and I think what's your say on that?
Yeah, definitely. I mean, whenever you're managing teams remotely, it is a lot of distributing that authority, very much, how Julie said, and that you are providing the resources to your teams to work in a variety of different environments. But then, so you are having that distributed authority, but then you are having more centralized coordination. And so there is you're setting those expectations. And again, you're having that clear communication of what the standard is for performance within your organization, and then giving them the tools to do that, and then having metrics for having some sort of measurement to know if those standards have been met. And if you do that, if you have laid forth, this is what the expectation is, these are the resources that we can give you to help you be successful in that, and this is how we're measuring performance, that is really one of the most straightforward ways to lay forth an expectation and lay the foundation for success within that remote team. And then, of course, adding in that very important human element that I discussed earlier, of making sure that you're still intentional of building those relationships and having that conversation, creating some sort of a virtual water cooler to continue those conversations, even virtually.
Yeah, I like the term virtual water cooler. Has a good spin to it. Okay. So I do see questions popping up on the chat window, but I think before we take the questions, I think just some final words from everybody, just in terms of the key lessons learned. I think we're almost into week 11 or week 12 of the lockdown. I think we have learned lots of things in these past 12 weeks. So so key lessons learned. So I think I'd like to start off from Scott Curry.
Thanks, Farouk. I think we've seen a very interesting transition with the virtual care adoption that we've seen, and I think when we look back on this pandemic, I think that's probably the one thing that we're going to look at that's going to really become a bit transformative for healthcare. I think leading up until now, there's been a fair amount of mistrust around the use of virtual technology in a clinical care setting. And I think what we're finding is that as we explore the technologies to enable this, we can actually do this in a very sensible and secure and easy to use way. And I feel like that lesson is going to really help us to change the way we operate from a healthcare perspective. You know, looking at sick kids, you know, we're a bit unique from a healthcare perspective in Ontario in that we have patients literally all across the province. So we're not necessarily just a regional health center in Toronto. And so the ability for us to have a virtual clinic visit with a patient in Barrie or Thunder Bay, which often does happen, is a significant opportunity for us to have a real impact on those people by making it accessible without them having to make their way down into Toronto in order to be able to get the kind of clinical care that they need. And so for me, I think the opportunity is, how do we ensure that we further enable virtual care? How do we ensure that all of the security requirements are absolutely met, because we do continue to have an obligation to secure that. But I think the opportunity from a clinical perspective is really absolutely amazing. So I'm looking forward to seeing how this turns out.
Amazing, thanks. Kashif.
Yeah, I think my thoughts are very similar to Scott's, is that this is a really opportunity and a call to action, is that the larger the organization, the more sort of siloed processes that they are and that sort of thing. And especially on the IT side, you know, we have a large research organization and some other people, and in the past, it's been quite decentralized and that sort of thing. So really what we're trying to do is review each and every process that's out there, and how can it be delivered more effectively, more efficiently, and more importantly, remotely as well. So like, how much work can actually be done remotely, and how much still is required to be done face to face. So I think there's a great opportunity to review everything, and you'll probably actually be able to even end up saving some money, although that's not really the main driver. But you can really streamline a lot of processes this way by taking a sort of optimized approach to this. So I think that's the key takeaway, just not to let things go status quo anymore.
Good point. So Amber.
Yeah, definitely one of the main takeaways that we learned from this whole COVID was if you are adapting to technology, you were way more prepared for this COVID situation than companies that were a little bit behind on being more adaptive to that technology in their business practices. And so the better we are and the more adaptable that we are to be more agile in our processes and in our use of technology, the more likely we are to be successful in pivoting whenever these types of situations arise. This isn't going to be this isn't the end of the conversation. It's really just the beginning. And so continuing to work with organizations to be more adaptable in both their processes and policies, but then also in their use of technology as well.
Thank you, Amber. And Julie.
Sorry, thanks. Yeah, I think it's really been more of a reinforcement of our core principles and of our business plan. We really focus ourselves on staying highly responsive to our customers' needs and requests that they bring forward. We've had to adjust our resources and priorities to meet our customers' needs, and like I have been sort of stressing all along in this panel, is that we're very customer focused and they're always at the top of our mind. So, but I think it takes on a much sort of stronger immediate need with COVID-19. So that means just being more open to having dialogue with our customers and seeking their input, and making any kind of appropriate changes that are needed. You know, I think it's more important than ever now to be listening to them and adapting to their needs. So the other piece is really just about the simplicity. And again, that's a hallmark of our product. It's become even more critical now than ever in the last few months. Companies were looking to strip away their cumbersome processes, and the whole idea of, you know, stopping, start, continue took on a whole new meaning. And I think with the old idea that working from home wasn't productive, We're also seeing companies like realizing that their existing processes aren't working, or they weren't needed, and now they're open to making changes. Like, you know, just echoing what Kashif and Amber were saying, like we just have to be more open to opportunities for technology use. So I think what that's changed for us is that we have to provide a solution that's extremely simple and easy to implement and understand. A lot of our customers have been technology averse or behind the times, so to speak. So it's been more critical than ever for us to be extremely simple and extremely easy to implement our software.
Okay, thank you. Thank you, Julie. So I think we can now move to the final phase of our session, which is taking questions. So the first question that we have, I think that question is for Amber. So the question is, in HR, how important is it for some professionals to meet their digital requirements, or I think that's more around digital skills, to perform their duties better? And what is the HR perspective on the subject?
Yeah, I mean, as far as assessing digital skills, I think I have seen a massive trend in that being a huge perspective, or a huge factor to take into account in the beginning hiring phases. Prior, this wasn't a massive factor that was taken into account. It is now. So I've seen different interview questions. I've seen even in that hiring process, using technology in the interview process to show some sort of adeptness to even very basic technology. And then for employee, so that's on the hiring phases and continuing moving forward. But then on the people that are currently employed in the company, there is again a focus on that training, on that continuing education, and then also on using that as a metrics in your performance, in that evaluation of performance and meeting those performance standards. So I've seen a trend on both ends, both on the hiring end and taking that into account whenever bringing in new people into the team on technology adeptness, but then also using that as a metrics and as an area for a standard of improvement and a standard of performance within teams and organizations today. So that comes from a training aspect and from using it as a metrics of performance.
Okay, thank you. Okay, the next question is for our hospital CISO. So the question is, do you think the hospitals in Canada could have been better prepared to deal with COVID-19 pandemic from a cybersecurity perspective? If yes, what are some measures that can be put in place should another pandemic hit us at any point in time? So Cash or Scott, whoever wants to take this question.
I mean, maybe I'll just make a quick comment and then hand it over to Cash. So I think it's a difficult question to answer in a straightforward way. I think, you know, broadly speaking, across healthcare, I think there are some ongoing challenges with cybersecurity, in particular in some of the smaller healthcare institutions that certainly create and result in some lingering vulnerabilities within the sector. But at the same time, I would say that there's definitely a lot of focus being given to security across healthcare. And from a sick kids perspective, I think we've been extremely well prepared for the types of issues that we're now facing. And in my role working with CISOs and other hospitals, both in Toronto and more broadly across the province of Ontario, you know, there is some growing collaboration around how we can work better together in terms of being able to deliver the kind of security that healthcare requires these days with the type of focused threats that we're seeing. So I think there is a bit of a scale to the answer that I think, you know, for the most part, I'd say there's been some preparedness, but we definitely have room to improve.
Your Cash.
Yeah, I agree with that. I think that you know, Scott and I are in sort of the enviable position of being you know, CISOs in these larger healthcare institutions, but you know, a lot of the other smaller regional hospitals and that sort of thing do have some challenges. I was speaking with one of them, and they had a security breach recently, and I think one of it was around you know, SOC and remote monitoring and 24/7 monitoring, and they found that you know, $80,000 or $90,000 price tag for a year for external SOC services was like a huge deal to them. Although for us, like it's like what's $8,000 or $9,000 between friends, you know what I mean? But for some organizations, it's a huge deal. So I think that Scott and I guess that's why we're part of these kind of gatherings as well. Is that it's incumbent on us is that not that we're so sophisticated, but we have some I guess ability to create these cybersecurity programs, and it's incumbent on us to share our learnings with the rest of the hospitals in the GTA.
Yeah, and I would just add to that as well that I do believe that there is some momentum building within healthcare, both within the healthcare institutions, but also with other types of industry organizations, whether it be Healthcare Can or others, all the way up to the government, to actually put more of a focus on this. And I've been involved in some conversations at various levels of the industry as well as the government, and the risks that we're seeing are becoming very materially real in many cases, and we've seen that impact within the Toronto area in the last 6 months. And so I think that there is that momentum that's going to start to hopefully begin to move the needle in terms of the way we as an industry are organizing ourselves from a security perspective. And I think, what Cash and I want to be able to do, not only through these types of forums, but many other ways that we interact with the healthcare industry more broadly, is how can we be leaders in trying to bring that message that security is a critical business priority, and that as such, it needs to be given the kind of focus necessary to ensure, at the very least, institutions and organizations are aware of the types of risks that they have and have some kind of mitigation strategy in place for those risks.
Okay, I think we just have time for another question. I think the last question is HR related. So the question is, it's a pretty interesting question. What would your advice be in regards to changing jobs in this current situation?
Oh, what a loaded question. I mean, is it bad to say it depends? But it honestly does depend. It depends on what industry you're in, what job you actually do. So I think that why you're leaving, if there's a company that you want to go to. So I think that there's a lot of factors in mind as far as a personal discussion on why you're leaving and where you want to go, and if you have something already lined up. So I think that's it's a very loaded question that warrants a lot of follow-up insight. Keep in mind, there really are two economies going on right now. You have companies like Zoom that are booming, and so you have aspects of an economy that are booming, and then you have some that are not doing as well. So I think that there is a little bit of insight in where you are wanting to go as far as in your career and in what industry. So I mean, it is a very loaded question that warrants a lot of follow-up. I will leave that to say, if you are looking for a job, there are companies that are hiring. There are a lot of people out of work, but there are companies that are hiring. So Zoom is one example. Amazon is another. We see companies. Julie's company is doing great. We're here at the Ninja Group. We are doing tons of training and being busier than ever, helping teams and organizations thrive in this new landscape. And so there are companies that are thriving. And so I would not rule it out as a possibility if you want to change jobs. I think that first, there is a series of other questions that need to be asked first, as far as where you want to go, why you're leaving, and what conversations have you had thus far in lining that next job up. So so it's not out of the realm of possibility. Absolutely not. There are jobs that are hiring, but I would have a series of follow-up questions first and do a little bit of soul searching.
With working from home, you can virtually work for any company.
Yes, that's so true. It's so true. Yeah, you can work for Julie. You can come work for us. Yeah, we're doing. Yeah. Virtual work is on the rise.
Geography agnostic, I guess.
Exactly. It's like the world is closed yet open.
Right,
Okay.
exactly.
No, that's a really good response. And yeah, I think there are lots of factors people need to consider while switching jobs. Anyways, I think we are right on the dot right now. In fact, we are about a minute over. The time is almost, it's 11:32 now, so we're 2 minutes over. But I would like to thank Julie, Amber, Kashif, and Scott for sharing some really good perspective on your experience with uh, continuing operations amid COVID-19. I learned a lot, and I'm sure the audience learned a lot. We had a record number of attendance at today's session. We had over 90 people joining our session today from all over the world. So thank you all for taking out time for speaking at today's event. And I think I'm looking forward to the keynote by Dr. Ann Kovukin, in which she's going to be talking about privacy issues related with contact tracing. So thank you again, guys.